In HCC, a number of trials have actually shown that PD-L1 inhibitors are effective in about 20% of the patients, but the problem is that we don't really know who are the patients that will benefit from this treatment. And in most of the other diseases where PD-1, PD-L1 therapies have been approved, we know that PD-L1 expression has been advocated as a predictive marker of response to these therapies. We don't really know whether the same concept would translate to HCC, and actually the studies that have looked at immune checkpoint inhibitors in HCC have not come up with a straight answer. So what we did as part of the Blueprint study has been to collect a large series of patients that had their resected specimen available. We are talking about 100 patients, and we profiled them with 4 of the key antibodies that are basically being used in routine practice as well as in clinical trials as FDA-approved tests, as companion diagnostics for the provision of immunotherapy. And I think the key result of our study is the fact that, unfortunately, there seems to be a lot of heterogeneity in most of the antibody platforms that actually measure the same protein. So we actually performed analysis to look specifically at the tumor cell uptake of PD-L1 as well as the inflammatory infiltrate either within the tumor or within the cirrhosis. And we found out that there is a large amount of heterogeneity across all the sample site. So we feel that this has got very important clinical implications. So at the moment, the development of immune checkpoint inhibitors in HCC is not supported by predictive correlates of response. So we just treat these patients without not knowing whether they will respond or not.